everything uploaded. But the previous 20 minutes, not really. So it was the last portion was not recorded. But don't worry, I have a group after you guys that have the same topic, so it's okay. So, okay, now it's on. So speaking about, it's always here if it's on or off. Please remind me always after each session. So the oncogene and the tumor suppressor gene, this will be for the next day, like tomorrow, because these are difficult. These are not easy. Okay? And they will take a lot of time. So for now, let's do a light topic. A light topic that will refresh your mind and make you love medicine again. I'm kidding. It will not make you love medicine that much. You should already love it. So, speaking about aflatoxin. Aflatoxin comes from aspergillus. What is aspergillus, guys? Fungi, yeah. He's the funniest guy in the world. No, he's a fungi. Fungi as in mushrooms. So this fungi basically make an aflatoxin. That aflatoxin is in grains and nuts, and mostly in the developing world, and it like in the wheat can be as well, in which you make a bread out of it. And then that aflatoxin you consume, and voila, hepatocellular carcinoma of the liver. So you can get cancer from eating a bread. Who thought so? Okay, the next one, alkalinating agent. When we speak about chemotherapy, we will say about some agents that are called alkalinating agent. They are funny because we use it to treat cancer and they cause cancer, okay? So you give a medication for someone to treat his cancer and you cause him cancer. Interesting. So yeah, these oncological chemotherapy, they work on the blood and they lead to leukemia and lymphoma. The next one is aromatic amines like benzidine and naphthylamine. Naphthylamine is mostly in cigarettes, you must know that. And the benzidine is in the textile industry, like the dyes. And yeah, the cigarette smoke, naphthalene. So it leads to cancer in the bladder. Your logical question will be like, well, if I'm smoking, how the hell is related to my bladder? Well, basically what happens is that this naphthylamine, after you smoke, it goes to your lung, then goes to your circulation, then gets cleared by your kidney. After getting cleared by the kidney, it keeps going down until it reaches your bladder, and that leads to the cancer of the bladder. Which form of cancer of the bladder? Is a transitional cell carcinoma. Make a note, transitional cell carcinoma of the bladder is the most common type of cancer. A non-common type of bladder cancer is called squamous cell carcinoma of the bladder, but it is the one caused by schistosoma hepatobium, which is most likely to be in Egypt on the USMLE. Okay? Did you write that? So, arsenic. Speaking about arsenic, well, basically, arsenic it's a herbicide which can be used for like vineyard workers, like people who work at the how do you say it, fields, and yeah, to kill the fungi. But also, it back in the time, just if you remember the story, it helped you to remember where exactly it's located. So back in Great Britain, there used to be two types of families. There used to be the nobles, noble people, and there used to be like, people who works in the field, which are basically like people from villages. What was interesting that the nobles, after some time, some of them started getting bored, especially the ladies. And they wanted to go and work in the field to make food for themselves, to be able to eat. But it was harming their prestige. So they were too afraid to go work in the field because it makes them look bad, So they started applying a substance on their skin to prevent them from getting a color, and people start telling them, oh, look at your skin, you become brown because you went under the sun. You are not noble anymore. You are working with the slaves. So what they applied on their skin? Arsenic. Arsenic makes your skin super white, but it gives you cancer. So be really careful about it. You are like, okay, why the hell you are telling us about this story? It's 200 or 400 years old. I'm telling you this story not to buy products from AliExpress from China that you apply on your skin and it makes it much whiter, okay? Because they do have arsenic inside of them. There is a lot of speaking about this and they can lead to cancer. Be careful. Okay, also metal smelting can lead to arsenic. What is this metal smelting? Oh yeah, so metal factory stuff. So let me show you. Metal smelting is people who work in metal factories. They have to make the metal in one shape, okay? Even the clearest metal do have some foreign structure, like arsenic, for example. And someone who works in the smelting the iron, some little particles can fly in the air and you can inhale them, and that can lead to cancer. Okay, so in the liver, they lead to angiosarcoma. Keep in mind that this cancer loves to bleed. In the lung, they can lead to lung cancer, obviously. In the skin, they can lead to squamous cell carcinoma of the skin. You can remember that from the story about the Byzants well, except that the Byzants, we had like the nobles. Okay, asbestos, old roofing material, shipyard working. What is asbestos, first of all? Well, asbestos is like a type of material, type of material that is used to be used in the 70s and the 60s to build roofs, okay? It's this one. It's pretty cheap, yes, it's really, really cheap. It's something like this. And it's actually not that heavy duty, you know, but still, it's better than nothing. People used to make shipyards out of them. Until now, actually, there is like third world country do have this. It leads to cancer, but if you guess who gets the cancer, the person who lived there or the person who built it? It's not the person who lived there. It's the person who built it. Why? Because the cancer happened during the cutting of these guys. Okay? When you cut it, during the cutting procedure, little small particles go out of it and you inhale them. That is the thing leading to the cancer. But if you speak about you are living in that building, if it's not destroying on you, you will not be inhaling them. And in the US, all over the US, in recent years, there is this advertisement that there started to come and be like, oh, did you get squamous cell carcinoma of your lung? Or carcinogenic carcinoma of your lung? Or mesothelioma? Come and get recompensation from the asbestos company. Oh yeah. So old roofing material and shipyard working, it leads to lung cancer, bronchiogenic carcinoma, more than mesothelioma. Be careful about this one. They know that mesothelioma only happens because of asbestos, so they like to trick you about this. But remember, the most common one is the bronchiogenic one. Okay, next one, cigarette smoking. It's funny about reading about cigarette smoking and speaking about it with someone who's an anti-vax who smokes. He's like, don't take the COVID vaccine. It changes your DNA. Freaking cigarettes do that. So, in the bladder, that can lead to transitional cell carcinoma. Keep in mind that was because of the naphthalamines, okay? Cigarette smoking can lead to cervical cancer, which one? Squamous cell cancer. But in the cervix, the most common cause of cancer is what? Come on, somebody tell me what is the most common cause of cancer in the cervix of the lady. Yep, a human papillomavirus. Can we prevent it? Yes, with giving a vaccine. Okay. The esophagus, also squamous cell carcinoma and adenocarcinoma. Keep in mind, squamous cell carcinoma happens mostly because of the cigarette. Adenocarcinoma can be due to the cigarette, but mostly it's due to GERD. In the kidney, renal cell carcinoma can happen because of the cigarette, which releases EPO, which is erythropoietin. Larynx, you can have squamous cell carcinoma because of the cigarettes. Lung, you can have squamous cell and small cell carcinoma. If you have a question about a lady, can someone who does not smoke get lung cancer? And he does not have a second-hand smoke. Can you get? Yeah, you can. And if they ask you what is the name of that cancer, it's adenocarcinoma of the lung, okay? So, oropharyngeal cancer can be as well, especially in whom? On people who do this chewing tobacco, okay? Chewing tobacco. Not this, chewing, not gum, tobacco, something like this. Not this, man, come on. Yeah, chewing tobacco. People put a little bit of tobacco in their mouth and nom 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 nom, they get cancer. Okay, something like this. Their gums goes away. Oh yeah, do not do that. So next one. So the next one is pancreatic cancer, pancreatic adenocarcinoma. Since this is fun, let me tell you about a story about pancreatic adenocarcinoma after I take a sip of coffee. In the 70s, there was a story about coffee leading to pancreatic adenocarcinoma. Is it true or false? Can coffee lead to adenocarcinoma of the pancreas? It's false news, it's wrong. But what is funny that they did a study. They found that coffee, which starts with a C, led to pancreatic cancer, okay? And after doing so many studies, so many investigated studies of hundreds of thousands of people, they discovered that coffee leads to pancreatic cancer. Approved. The p-value was low, everything was correct. What mistake was there? The mistake was something like this. People who drink coffee tend to smoke, okay? But they did not check the smoking. But people who do coffee, who exactly, it's a bias, who do coffee tend to smoke more. So they get pancreatic cancer. Meanwhile, in the 70s, all doctors used to tell their patient, look, don't drink coffee, it leads to pancreatic cancer. That was stupid. It's the smoking that leads to the pancreatic cancer, not the coffee. But people who drink coffee have an association with the smoking. So this thing, we call it what? Bias. We call it a confounder. It's something that you cannot see, but it's leading to alteration of the result. This is biostatistics. That's how I'm going to explain you biostatistics when we reach it. Don't worry guys, biostat is not that bad. Okay, next one, ethanol. Oh yeah, it's good for your liver. Yes, it leads to hepatocellular carcinoma. And for your esophagus, it leads to squamous cell carcinoma. Oh my god, is it breaking again, guys? Can you hear me normally? Okay, good. So for ethanol, it leads to squamous cell carcinoma of the esophagus, and it can lead to hepatocellular carcinoma of the liver. Ionizing radiation, especially after a nuclear disaster, for example, Chernobyl, which is happened in Ukraine in the 1989, after the nuclear number 4 has exploded, leading to separation of a lot of basically radiation clouds, throwing a lot of radioactive substances in the rain at people, which led to a lot of papillary thyroid cancer in these people. Guys, God forbid, God forbid, God forbid, you have a nuclear, something nuclear, anything near you, you need to do the following for your patient. You need to do iodine. Yes, oral iodine, okay? And if you give oral iodine, why do we give it? To prevent the chance of your thyroid gland from taking the radioactive iodine that is coming from the nuclear reactor. So instead of getting the iodine from the nuclear reactor, you are taking normal iodine, which will saturate your thyroid and prevent you from getting papillary thyroid cancer. Okay, so radiation also can lead to leukemia. We'll speak more about them in biochemistry. Nickel. Okay, nickel, chromium, beryllium, and silica. They all can lead to lung cancer, and we'll speak about them in pneumoconiosis, which are occupational diseases, and they happen due to occupational exposure of workers. So nitrosamines are in the smoked food. And guys, which country has the most smoked food? All of their food is smoked. No, not Ukraine. It's an Eastern country, not Mexicans. No. I'm speaking about a country that do a lot of smoked fish, and they eat a lot of fish. Japan, excellent job. So, guys, some cancer are associated with countries. Please make a list of them. So, Japan, you have what? You have the nitrosamines that lead to gastric cancer. China, you have the nasopharyngeal cancer. Okay, nasopharyngeal cancer in China. Okay, if you have someone from Egypt, think about bladder cancer due to schistosomiasis. Okay, so each country has its relationship. If you have someone from Africa and he has a facial mass, think about Hodgkin's lymphoma. Okay, so each country has its disease. If you have someone from Eastern Mediterranean countries, you start to think about thalassemia. If you have someone who is like an Ashkenazi Jew, you think about pancreatic cancer, and you also need to think about this lysosomal storage disease like Tay-Sachs disease and Niemann-Pick disease. Okay, so keep these in mind. Like, you can just see where is he coming from, and you can know the disease. Okay, so nitrosamines, it's from smoked food. I just said it from my brain. I can make you one. Okay, I will make one since I just said them from my brain. I will make you one and send it because I just said it from my brain. Okay, I will write it. Just remind me after the class to write it. Please remind me, because if nobody remind me, I will not remember. So, radon. When you buy a house, guys, when you are going to purchase a house in the future, you are going to finish residency, get a mortgage, and buy a house. You buying a house, and the first thing to do is to what? To check the radon in the basement of that house. You go and check the basement. You go to this beautiful house with 6 bedrooms and tell the man, can we go to the basement? He'll be like, what the hell is wrong with you? Like, I'm going to check radon. Well, yeah, don't say it in that tone, but go to the basement and check for the level of radon. There's devices that can check for this. Well, let's say that you are like, well, it's not a big of a deal. I can just open the window and it will clear out. Not really. It sticks inside of the walls and it penetrates deep. So you have to destroy the whole house and build a new one if it's there. You cannot clean it. You cannot remove it from there. If it's in there, it will stay there basically. And there is no way you are going to get rid of it except if you destroy the whole house. So there is no point, as you can see. So simply do not buy a house that has radon in the basement. So you are like, why? Because it can lead to lung cancer, which is the second leading cause after cigarette smoking. So cigarette smoking is number 1. Okay, the next one is vinyl chloride. It's used to make PVC pipes, and I hope you know what is PVC pipes. It's this white pipes. PVC pipes. PVC pipe. It's these white pipes, like small pipes. Yeah, these ones. So people who keep working with these can get a lot of vinyl chloride in their system, and that can lead to angiosarcoma, rarely hepatocellular carcinoma. Okay. Remember that the angiosarcoma always bleed. So the next one is this. Oncogenic microbes. Speaking of oncogenic microbes, we have the following. The first one is EBV, which is Epstein-Barr virus. Epstein-Barr virus can lead to Burkitt lymphoma. And this Burkitt lymphoma is more commonly in which population, guys? Which population is at high risk of Burkitt lymphoma? So keep in mind, I will send a picture. Yeah, it mostly affect what the African American, like the African population, and it leads to this mass in the jaw. It's really bad, and it's difficult to treat, but it's not always fatal. So don't think that it's always fatal. I even sent, you can check Telegram here. So I sent this picture. Also, I'm sending you guys one more picture here. And this is a histological specimen of it, which basically is showing you a lot of lymphocyte with macrophages. This white structure are macrophages all over the place. This is a Burkitt lymphoma. We call it like a star-like appearance, okay? So starry sky appearance, exactly. There is like, this is a lot of lymphocytes with some macrophages in between. Okay, so next one. So the next one is Hodgkin's lymphoma. We'll speak about the difference between Hodgkin's and non-Hodgkin's lymphoma when we reach it. But overall, Hodgkin's lymphoma like to affect one set of lymph nodes, while the non-Hodgkin's are more dispersed all over the body. Nasopharyngeal carcinoma, which country? Which country has a lot of nasopharyngeal carcinoma, guys? China. Exactly, it's China. Okay, which country has a lot of gastric cancer because of the nitrosamines, because of the smoked food? Japan. Good. What about Burkitt lymphoma? Africa. What about someone from Egypt have blood in his urine, but it's painless? Bladder cancer because of the schistosomiasis. Exactly. Good. So primary CNS lymphoma in immunocompromised patient. Okay, primary CNS lymphoma, it can be in immunocompromised patient. Guys, I have this mnemonic, it works, and I want to teach it for you. If we write lymphoma, how many O is in lymphoma? Okay, one O. If I write the word toxoplasmosis, how many O in toxoplasmosis? Okay, fair enough. Let's take a look at the brain MRI. So if we speak about lymphoma, it's a solitary lesion. One lesion because one O, okay? One lesion, one O. Done. One lesion, one O. Immunocompromised patient, one lesion, one O. But if you speak about toxoplasmosis, how many O's? Many O's. So many lesions, okay? Many lesions. That's the easy way of differentiating toxoplasmosis from lymphoma of the brain in an immunocompromised patient. Okay, let's count. 1, 2, 3. How many, what is it? Toxo or lymphoma of the brain? Toxo, done. Okay, close your eyes. And let's take a look at this one. How many lesions? One lesion. So what is it? Okay, a lesion is continuous. Lymphoma, done. You can differentiate between lymphoma and toxo. Next. So EBV and, hepatitis B and hepatitis C viruses, both of them are oncogenic viruses that can lead to hepatocellular carcinoma. Keep in mind that the hepatitis C is much worse than the hepatitis B actually, because if you get hepatitis B, you have a chance to clear it out. Also, we have a vaccine for it, so you can, if you get the vaccine, you will not get it. While in case of hepatitis C, there is less chance of getting it. There is no vaccine because of the antigenic variation. They ask about this antigenic variation, and basically, if you get it, you have a really high chance of having a chronic disease. So that's hepatocellular carcinoma. The next one is Cabozzi Sarcoma. And this Cabozzi Sarcoma is basically a vascular tumor. A vascular tumor, especially in whom? In someone who's an immunocompromised, okay? So, yep, I'm just going to send you a picture of it. It's a vascular tumor. Basically, this picture you will see in a second, this is basically just vessels becoming, having a lot of VEGF. which lead to a lot of vasogenesis in this region, and it's really famous in the immunocompromised population, which lead to the cancer. Okay, the next one, HPV. Guys, you know, when you become educated in a really good way, there will come the day that you will go to your doctor and you will understand that you know a little bit more than him. That will happen with all of you, hopefully. So why? For example, I went the other day to get HPV vaccine. I want to get it. So the doctor was like, why the hell do you want to get it? You know, you are a man, you cannot get cervical cancer, you are not homosexual, you will not get anal cancer. And by the way, circumcision prevent against penile cancer. So he was like, you have zero risk factors. Why would you think about getting it? Because it prevents head and neck cancer. He did not believe me until I show him. So you need to know that HPV can lead to cervical cancer in a lady, penile cancer in men. For prevention of cervical cancer in a lady, vaccination. Penile cancer in a boy, circumcision and vaccination. Anal carcinoma, mostly the ones who get it, the anal carcinoma are the homosexual population, especially from the type 16 and 18, 31 and 32. Head and neck cancer, super serious. It can even go to your nasopharynx. So yeah, I am with vaccination for both boys and girls for HPV. Sadly, you need to get vaccinated before the age of 26. You don't get vaccinated after 26 because it becomes useless. So, sorry. Well, some people say 45, but for the step 2, for the sake of step 2, not to get the question correct, the limit is 26, okay? But in reality, you can give it after. But for the USMLE step 2 CK, the limit is 26. Do not play with them on that. They will put you the question wrong. I know sometimes for the USMLE exams, like especially the step 2 CK, you should not follow the up-of-date information. You should follow what your words say, because you can get the question wrong if you follow that. So, H. pylori, gastric cancer, gastric adenocarcinoma, and multiple lymphoma. Multiple lymphoma is mucosa-associated lymphoid tissue lymphoma. And it's important. Why? Because it's one of these rare type of tumors, you know, in which if you treat the H. pylori, the multiple lymphoma goes away. It has this rare characteristic. Normally tumors, when they start, they don't stop. But this multiple lymphoma, if you treat the H. pylori, the multiple lymphoma goes away. The next one is about HTLV1, which is a form of virus that can affect you, and after it affects you, it can lead to cancers. It can lead to non-Hodgkin's form of lymphoma, which is a T-cell mediated, which is quite rare. I have to tell you something about the non-Hodgkin's lymphoma. So the non-Hodgkin's lymphoma can be B-cell lymphoma or a T-cell lymphoma, okay? So if we speak about the B-cell lymphoma, which is the most common, they have many stuff except one thing. They cannot, this is important, they cannot have mostly rash, okay? They cannot have a rash. But if we speak about the T-cell lymphoma, always they have a rash. One of them I'm going to tell you about in the future. It's called Cesar Syndrome. Cesar, come on. Oh yeah, here it is. See, rash all over the body, really itchy. Okay, so if the patient has leukemia with a skin rash, you think about T-cell lymphoma or leukemia. No rash, B-cell leukemia or lymphoma. Liver fluke, Clonorchis sinensis, can lead to cholangiocarcinoma of the collecting duct. And lastly, schistosoma hematobium, it can lead to squamous cell bladder cancer in someone who's coming from which country? Yep, Egypt. They like to tell you about Egypt. Okay, so I think that's fair. that was fun. The last section we did, it was fun. It was like most of the topics we are going to explain after finishing renal. Okay, so that was it for today, and